Hi.
Hi. Okay. After reviewing Steve's chart and given his assessments and the concerns that you've brought forth today with his behavior and memory at home, I would like to prescribe a medication called Donepezil, also known as Aricept, to monitor his body's response to the medication. Steve's score of a 22 on his mini mental examination is consistent with mild cognitive impairment related to Alzheimer's disease. I'm going to go over some pertinent education with you guys regarding the Donepezil and answer any questions that you may have.
Okay, sounds good.
Donepezil is part of the drug class called cholinesterase inhibitors. It is used to slow down the progression of Steve's cognitive, behavioral, and functional impairments. It can also have positive effects on any anxiety, agitation, or depression that may develop as well. Our goal is to maintain his current abilities with independence, and this medication will not cure any progression of dementia or Alzheimer's disease. So this is a very important concept to grasp with the use of this medication.
All right.
Okay, so I printed out a prescription here. So it's going to be for Donepezil, 5 milligrams. I want Steve to take 1 capsule by mouth daily at bedtime. And then I'm only going to give you guys a month's supply right now just to kind of monitor how his body responds to this, and then we can reconvene and decide what the best step is going forward. Okay. And then also looking back at his records, I see that Steve takes Flomax for his urinary frequency. Please let me know if it is switched to any different medications. And if Steve takes other medications with anticholinergic effects, it can exacerbate gastrointestinal discomfort. And since Steve already deals with irritable bowel syndrome, I want to keep a close eye on the side effects that he may exhibit with the start of this Donepezil. Donepezil can also increase gastric acid release, so I'd like you to limit his use of NSAIDs like ibuprofen, especially for his knee pain that he complains of on that right side.
Okay.
Limiting the use of these is help to prevent ulcers from developing. Other side effects reported with the use of Donepezil include headache, muscle cramps, weight loss due to decreased appetite, and I know you said he likes to eat all the time, so that might be a good or bad thing. Sleeping trouble, upset stomach, and tiredness. Any severe types of allergic reactions like itching, swelling of his throat, face, troubles breathing, anything like that, or severe abdominal pain, faintness, blood in his vomit, or trouble breathing, I would like you to take him to a medical facility right away.
Okay.
These are more severe side effects related to the Donepezil, but I want you to be aware of them just in case they were to arise. Okay, so with this 5 milligram tablet, I want him to take it at bedtime with water. He can take a snack with it if he wants, he doesn't have to. Donepezil is taken at night due to its effect on slowing the heart rate down. So this can in turn cause people to feel lightheaded and dizzy. So that way, if we give it to him at night, he can sleep off the side effects instead of feeling really tired and dizzy during the day when he's trying to be up and functioning. If he starts to develop any nightmares or an insomnia with this medication, we can readjust the dose to be taken in the morning, but hopefully we won't run into any of that. If he's having bothersome side effects where he does not want to take the medication anymore, please let me know right away. We can adjust some things around accordingly. And there are other options available, or some side effects can be treated if that's what is really bothering him the most. And if you guys miss a dose, go about the regular routine. Do not take 2 doses at once to make up for the missed pill.
Okay, so about how long until we should start to see some results from the Donepezil?
Okay, great question. I will have you follow up with me in 4 weeks, like talked about before. If there are no effects seen within the first 4 weeks of starting the Donepezil, we can increase the dose to 10 milligrams a day.
Okay.
It can take up to 3 to 6 months to see results overall, so that's why we'll kind of follow up closely to see how everything's going. If any adverse effects are noted, we can switch Steve to a different anticholinesterase inhibitor if we need to. Otherwise, if positive effects are noted, we will keep him on the Donepezil with close follow-ups. Different drug classes are used if his dementia would progress from mild to moderate to more of the severe phase. So at this 4-week follow-up appointment, I'll have Steve repeat the mini mental exam to compare related to what he scored today. This will be done with each follow-up about every 3 to 6 months to monitor cognitive decline or improvement with the treatment regimen. Okay? I want to go over some recommendations for modifications for your home life as well. It is beneficial to stick to a routine or a schedule and decrease drastic environmental changes with those going through cognitive impairment like this, like going on vacation, getting out of routine with schedule, bedtime, meals, stuff like that. I I would recommend taking away his driving privileges at this time for the safety of all involved.
Okay, well, he hasn't driven for quite a while
Okay,
now.
good.
So
That's a
not
great
problem.
decision. You can also make signs to put around the house. These signs can contain what time meals are at, daily reminders for his ADL activities, a daily living tasks like when to shower, what clothes to put on for the day, make sure you shave. And then the most important thing is keep including him with board and card games, family functions, keep interacting him with conversation to help keep engaging that brain and cognition.
He loves board games and dice games,
Great.
so that's
So
not a problem.
That will be easy to keep him involved then. Since Donepezil can result in decreased hunger, like we talked about previously, please keep an eye on his diet and ensure he is getting adequate nutrition. You can keep a weight dialogue if you would like, just so we can monitor that together if we're getting concerned with too much weight loss.
Okay.
And if his voiding frequency changes to incontinence, where he's not able to make it to the bathroom, he's wetting the bed, wetting through his clothes, please let me know right away, because I want to get him on a different medication to help prevent all that. Encourage Steve to get out of bed or up from the furniture slowly to avoid lightheadedness and passing out as well, just because that medication can decrease his heart rate.
Okay.
And lastly, I wanted to hand you these available support groups for caregivers of dementia and Alzheimer's disease. Just like it's very important to take care of Steve and your loved one, it is very, very important to give yourself the support you need as well. With caregiver supports, I want you to have all the resources you need to support during this journey, and I'm also available at any time if you have questions, concerns, what my thoughts are on certain resources for you guys as well. Okay, do you have any further questions for me?
So is there a bigger concern with his progression due to his mother's history with severe Alzheimer's?
So there is a bigger concern regarding his family history of Alzheimer's disease with his mother. Alzheimer's disease, there's genetic mutations of proteins that can be passed down generation to generation, which means some people have the mutation but they can develop the disease, and others have the mutation and don't develop the disease.
Okay.
So research shows that treatment remains the same given the symptoms either way. So that's something that can be tested further down the road if you guys would like.
Okay, that's good to know. Thanks for all your time and recommendations today. I really appreciate it.
Yeah, no problem. It was my pleasure. The prescription's ready for you guys to take to any pharmacy you would like to use to fill, and please keep in contact with me. I will have my office call you in a few weeks just to kind of check in, see how things are going, and if you need to get in with me sooner or later.
Okay,
Okay.
sounds good.
All
Thank
right.
you.
Yes, have a good day.